This is an x-ray. Anything that's white on this x-ray is very hard. So this white part right here, that's metal. It's very hard. It's solid. Anything that's dark is just air. Okay? So here we have air. Here we have bone. It's not as white as the metal because it's not as dense as the metal. It's not as hard as the metal. It has calcium fluoride in it. Here's the tooth. Again, not as hard and white as the metal. Okay? What's this right here? That's the porcelain that's on top of that crown. That's part of that crown. It's not as hard as the metal. Okay? And so this area right here should not be here. What do you think this is right there? That's an abscess. Correct. Is there any question about that abscess? That abscess is basically the bacteria killing the nerve and starting to leak out the bottom of the tooth, causing a little ball of pus at the end of that tooth. The body starts to form a wall around that to keep that pus concentrated away from the rest of the body, to wall it off away from the body. That's what the body's doing. So that's an abscess. Any questions about that? That is an infection. An abscess is an infection. Just like if you get a cut on your hand and it swells up and it has pus, that's an infection. No different. It's just inside the mouth. How do you get rid of it? A, you can either do a root canal, or B, take out the tooth. Because the tooth is harboring all the bacteria.
When you're doing the root canal, like when that one patient was bleeding, is it because you went down and then the abscess is obviously
Correct.
going into that, so all of that is
coming out. In fact, when it hurts, it's because this abscess is walled off in here and it's starting to build up pressure. And it's trying to push that tooth out and it hurts.
So when you put the root canal
When
to
you-
clean it out, it's like a geyser. It releases the pressure.
Correct. You don't want to be in that situation because that means that the tooth can't be numbed. I can't put enough anesthetic in this area to numb this part.
So wouldn't you just make them go on antibiotic for a week before they come in to do the procedure?
That's the only option they have. They go on antibiotics for at least 3 days. The first 3 days, the antibiotic will start working after the first 3 days.
Okay.
If it's real bad, send them to the emergency room, like that patient yesterday.
So minimal 3 days.
So, okay, so for billing purposes, this is your abscess.